The present topic of discussion, it is on diseases of skin, which is part 2. So herein we will discuss the remaining important dermatological lesions with oral manifestations. So now let's go into the diseases of skin. The first of it is erythema multiforme. So the basic presentation, actually like erythema multiforme, it is an acute self-limiting condition which affects both mucous membrane as well as skin. So it is a mucocutaneous condition which is self-limiting, that is it heals by itself. Okay, and erythema multiforme, it is divided into 3 types depending upon the severity of the lesion, wherein the mild form of lesion is called as erythema multiforme minor, followed by erythema multiforme major, and the severe form is Stevens-Johnson syndrome. Okay, and the characteristic lesion that is seen in erythema multiforme is target or iris lesions, as you can see in the picture. This target or iris lesions, what we see here, it is the name itself says erythema multiforme, right? So it is these iris lesions, they form because of the erythema, varying shades of erythema. So what is the main etiology behind this erythema formation in this disease? The first is drugs like sulfa drugs, which are the main causative factor for major, that is erythema multiforme major and Stevens-Johnson syndrome. And there is a viral etiology also, that is herpes simplex virus, which gives rise to erythema multiforme minor, wherein this HSV, it harbors our epithelial cells. So whenever, as it is a foreign antigen, HSV, so it will be taken up by the dendritic cells which are present in the epithelium, that is our Langerhans cells. As antigen presenting cells, they will take up this HSV antigen and they go to the lymph node and present it to CD4 plus T lymphocytes, wherein now the CD4 plus T lymphocytes, they will get activated and move to the site of antigen, that is towards our epithelium, wherein it will start to produce a cytokine called as interferon gamma, which causes epidermal damage. So this kind of erythema multiforme is called as herpes associated erythema multiforme. Other than drugs and herpes simplex virus, even mycoplasma is supposed to be one of the etiological factor. Now going into the manifestations of different types of erythema multiforme. So minor lesion, wherein there is involvement of mucous membrane which is limited to only one site. So that one site will be most commonly oral mucous membrane only. And there will be cutaneous manifestation in the form of rashes, as well as, like I told before, even target or iris lesions will be seen here. So these target or iris lesions which are present here will be seen on the extremities, and these will be flat in nature. Whereas in case of erythema multiforme major, this is little severe compared to minor, wherein multiple mucosal sites will be involved here. And also systemic manifestations will be similar to that of the minor. And here here also we will see this target or iris lesions, but here what happens is that these iris lesions will be raised and atypical, that means we can palpate them, whereas in case of minor it will be flat in nature, whereas here they will be raised, that means even they are palpable. Whereas in case of Stevens-Johnson syndrome, here it is a very severe form, wherein it is wherein we see numerous vesicles as well as bullae which are involving oral, ocular, skin as well as genital lesions. So as it has a varied manifestations, it is like it is a syndrome, Stevens-Johnson syndrome. Now let's see all these manifestations together, that is oral manifestations, wherein mainly lips are involved here. That too, the lips, they will become swollen and they will be cracked. Whenever there will be crack, there will be bleeding and followed by crustaceans. So bleeding and crustaceans are the main characteristic feature that are seen in erythema multiforme, followed by our target or iris lesions or bullseye lesion, which is because of the varying degrees of erythema or varying shades of erythema, these target lesions are formed. Whereas in case of Stevens-Johnson syndrome, other than these lesions, there will be severe vesicles and bullae, I told you, right? So here what happens is that there will be these bullae and ulcers which will be formed, bullae and vesicle will be formed, which will rupture to form ulcers, resulting in a thick white or yellowish exudate on the surface of the ulcers, as you can see in the picture. All the tongue as well as even the lips are involved with ulcers. Other than oral ulcers, we will see ocular lesions in Stevens-Johnson syndrome, wherein there will be photophobia, conjunctivitis, corneal ulcerations, and all these symptoms, they will become more severe, sometimes resulting in blindness. So now oral lesions are over, ocular lesions are over, then followed by genital lesions in Stevens-Johnson syndrome. Genital lesions where there will be urethritis, balanitis and vaginal ulcers will be seen. So this is about manifestations of Stevens-Johnson syndrome. Now we'll see the histological features. So as epidermal damage will be there, right? So epidermal damage results in vesicle formation within the epithelium. So this epithelium, vesicle will be either intraepithelial vesiculation or subepithelial vesiculation, as you can see in the microscopic picture. That hole like thing is there within the epithelium, that itself is a intraepithelial vesicle. And as a result of epidermal damage, there will be necrotic as well as apoptotic keratinocytes will be there. As a result of necrosis, there will be so much of inflammation beneath the surface of epithelium, that is diffuse mixed inflammatory infiltrate will be seen in erythema multiforme. So this is about erythema multiforme. Next, moving to the second disease, that is systemic lupus erythematosus. This systemic lupus erythematosus, it is an autoimmune disease, as well as it also manifests as type 3 hypersensitivity reaction, wherein immune complex will be formed within circulation. As I told you, it is autoimmune. Here the autoantibodies will be against the nuclear bodies as well as blood cells, that is DNA, nuclear antigens, RBCs, WBCs, etc. As it is like a type 3 reaction, so here immune complexes will be formed within the circulation. So here, as a result of autoimmune nature or any environmental antigens, these hidden antigens will be released and they will be produced into the circulation, to which autoantibodies will be formed, wherein antigen antibody complex will be seen within the circulation. So once this antigen antibody complex is there, it will recruit inflammatory cells to the site, and now antigen antibody complex with the inflammatory cell, they will go and bind to some place within the blood vessel. So as inflammatory cell, like it main function is phagocytosis, it will release lysosomal enzymes, resulting in damage to the vascular wall, resulting in vasculitis. So as blood vessels are everywhere, it can result in manifestations in many organs like kidneys, skin, blood vessels and CNS. That is why it is systemic lupus erythematosus. This is the main etiology and pathogenesis behind SLE. So what will be the clinical features? So as it is an autoimmune disease, most of the autoimmune diseases have female predilection. So here also we see female predilection, and most commonly seen in middle age. And here the skin lesions will be there, I told you. So cutaneous manifestations will be in the form of erythematous patches, as you can see in the picture. Whole, like on the cheeks you can see that erythematous patch, as well as on the nose also. So these erythematous patches, they will be roughly symmetrical, seen on the cheeks as well as across the bridge of the nose, giving a butterfly rash appearance. This is also called as malar rash, as it involves the malar bone, that is on the cheeks. So this is cutaneous, whereas kidneys, systemic manifestations, here because of the deposition of the immune complexes, there will be fibrinoid necrosis, sometimes resulting in failure of kidney. And even in heart also there can be fibrinoid degeneration of both epicardium and myocardium. Other than this, neurological manifestations will be there, which can result in seizures as well as psychosis. Whereas hematological disease, as autoantibodies are produced against RBCs and WBCs, there will be decrease in the blood cell count, resulting in anemia, thrombocytopenia, leukopenia and all. Okay, so these are the various other manifestations. Coming to oral manifestations, they are mostly seen on palate, buccal mucosa and gingiva, and here the manifestations, they will be similar to lichenoid areas, as you can see in the picture, wherein there is an ulceration which is surrounded by whitish striae, like you can see in case of erosive lichen planus. So these are the manifestations of SLE. Now let's see histological features. So this is the histopathological picture of SLE, wherein here we will see hyperkeratosis, that is thickness of the epithelium will be there. Sometimes even there will be alternating areas of hyperkeratosis and atrophy of the epithelium also. And there will be follicular plugging, as you can see in the picture. The arrow represents that area of follicular plugging. And because of the damage to the epithelial cells, there will be basal cell degeneration, which is liquefactive degeneration, and diffuse chronic inflammation can be seen, as well as perivascular inflammation, that is around the blood vessels. As it is a blood vessel disorder, this is a perivascular inflammation can be seen. Okay, sometimes because of the manifestations, this SLE is also considered as collagen disease also. Okay, so as it is a skin disease, we will also do immunofluorescence test here. Like in case of lichen planus and all, there is a linear deposition of antibodies, right? Here there will be particulate or speckled pattern of immunoglobulins will be seen on direct immunofluorescence. So what are the immunoglobulins? IgG, IgM and IgA. Particulate or speckled pattern here. Whereas in case of pemphigus, it will be fishnet or chicken wire. Whereas in case of lichen planus, it is linear. Whereas here it is particulate or speckled. And there will be we can even do some laboratory findings wherein there will be elevated ESR as well as C-reactive protein, and upon serum protein electrophoresis, as it is an autoimmune disease, there will be elevated gamma globulins will be there. As globulins are increased, there will be decreased albumin content, and like I told before, there will be decreased blood cell counts, and as kidneys are involved, there will be serum nitrogen and creatinine levels which are elevated. Serum nitrogen and creatinine levels are elevated, and this is an autoimmune disease. So auto antibodies can be tested for, wherein anti-nuclear antibody test we can do, anti-DNA antibody test we can do, or anti-Smith antibody test. These are the various laboratory findings apart from histopathology as well as immunofluorescence in SLE. Now let's move into the third disease, that is systemic sclerosis. The systemic sclerosis, it is also called as scleroderma, as well as dermatosclerosis or hide-bound disease. These are the various names of systemic sclerosis. And what is the main problem behind this disease is that there will be increased collagen deposition in tissues. Increased collagen, because there will be increased collagen deposition, it results in sclerosis, and that to systemic they are saying. That means in various organs this collagen will be deposited, resulting whenever there is increased collagen deposition, what happens? There will be fibrosis. So fibrosis of skin will occur, fibrosis of blood vessels and visceral organs and mucosa. So wherever collagen is there, this fibrosis will occur, resulting in sclerosis. What is the reason behind this fibrosis? So let's discuss pathogenesis of systemic sclerosis or scleroderma. So some say that it is actually an autoimmune disease wherein some genetic factors are involved, that is as autoimmune disease, right? So there will be mutations in HLA-B8, DR5, DR3 and DR52. Other than being an autoimmune or genetic factors, it can even result from UV radiation, other radiations, pollution, viruses and drugs. What all these things will do is that they will result in production of free radicals. So these free radicals are harmful for the body, wherein these are released in the blood vessels, resulting in endothelial cell injury that results in vasoactive mediators release or production of or increased recruitment of are inflammatory cells like T cells, B cells as well as macrophages, where they help in production of autoantibodies as well as cytokines and chemokines. Now what all these things will do, vasoactive mediators, chemokines or cytokines and autoantibodies, is that they help in activation as well as recruitment of fibroblasts. So as fibroblast activation and fibroblast recruitment is more, fibroblast main function is collagen accumulation. So because of collagen accumulation, there is the main pathology, that is fibrosis will occur. So that resulting in systemic sclerosis. So what are the clinical features? As this collagen is deposited in various tissues, first we will see cutaneous manifestations wherein skin will become tight, that is hard, induration of skin will be there, as well as fixation of the skin, that is epidermis, to the underlying subcutaneous tissue. So the suppleness of the skin will be lost, okay, because of which the skin, it will become hardened, and whenever there is good suppleness, we tend to see that wrinkles, and we can even pick up our skin. But here, because the skin is hardened and it is fixed to the underlying subcutaneous tissue, wrinkles will not form and it cannot be picked up, so resulting in contractures of the skin. So whenever there is contracture of the skin, the face, the expressions will not be seen and wrinkles will not be there, resulting in mask-like appearance of the face, as you can see in the picture. This is mask-like face appearance. And even in the fingers and hands and all also, if you see, the skin will be tightly bound to the underlying subcutaneous tissue, as you can see in the second picture, resulting in claw-like hands. Okay, claw, mask like face and claw like hands. And there is one more condition called as morphia, which is circumscribed scleroderma, that is, this is pigmentation basically, wherein there will be well defined, slightly elevated white or yellowish pigmentation which is surrounded by violaceous halo, as you can see here. This is circumscribed scleroderma. Sometimes linear scleroderma also happens. So this is mostly seen on the forehead, chest as well as trunk, but forehead is more common. Here what happens is that a ridge-like elevation is formed on the forehead, as you can see in the picture. So this ridge-like elevation, it is most commonly termed as coup de sabre. That means it will resemble the mark produced by a blow of a sabre. Sabre is nothing but a sword. When you give a blow with a sword, like you can feel that elevated ridge on the forehead. That is linear scleroderma. Now moving into oral manifestations. So mostly tongue, soft palate, larynx, these are the main structures which are involved. When tongue is involved, it will become stiff and board-like, causing difficulty in eating and speaking. And tongue will become, as fibrosis is more, it will appear paler, as you can see in the picture. And sometimes lips will become very thin and rigid. As lips become thin and rigid, it will not open fully, resulting in microstomia, that means smaller mouth. And because of the involvement of pharynx and everything, there can be dysphagia also. And as there is microstomia, there will be limited mouth opening. So this limited mouth opening can be because of microstomia or involvement of the TMJ also. So what are the histological features? So there is increased collagen deposition, right? So normally if we see in connective tissue, there will be here and there bundles of collagen will be there, but here it is a collagen disease itself. So hyalinized collagen will be seen. As you can see in this microscopic picture, there is a thin layer of epithelium there with underlying connective tissue, and because the collagen deposition is so much, it will cause atrophy of the epithelium. So epithelial atrophy with loss of retiridges will be there, and the underlying connective tissue shows hyalinized collagen. As collagen here it is hyalinized. Collagen is present around blood vessels also, right? So there will be sclerotic blood vessels that will be seen, and it will compress the subcutaneous fat also, because of which there will be loss of subcutaneous fat tissue. So these are the various histological features that are seen in scleroderma. Now next disease, it is Ehlers-Danlos syndrome. So Ehlers-Danlos syndrome, basically it's a hereditary disease wherein the genetic defect, it lies in the collagen as well as connective tissue synthesis. So the defect lies in the synthesis of collagen as well as connective tissue. So whenever there is collagen is defective, collagen is present mainly in skin, joints and blood vessels, right? So these things will be defective in Ehlers-Danlos syndrome, skin, joints and blood vessels. And in the synthesis of collagen, there are various steps. So depending upon the steps involved, like there are some 10 different types of Ehlers-Danlos 10 different types of inherited disorders are there, which comes under Ehlers-Danlos syndrome. So of which first and second type of EDS, wherein there will be mutation in collagen 5A1, collagen 5A2 gene as well as tenacin 10 gene. So because of this tenascin 10 gene, even Ehlers-Danlos syndrome is called as tenascin 10 deficiency syndrome. Whereas the type 4 is caused by decreased type 3 collagen. That means type 3 collagen is reticular collagen, which is mostly present around blood vessels. So blood vessel disorder will be there. Whereas Ehlers-Danlos type 5 and 6 has deficiencies in hydroxylase and lysyl oxidase. Type 7 has deficiency in procollagen peptidase. All these enzymes, hydroxylase, lysyl oxidase, procollagen peptidase, these are the enzymes important in collagen synthesis. So if there is a deficient, collagen formed will not be proper. And ninth EDS, wherein abnormal copper metabolism will be there. Copper is an important mineral helping in cross-linking of collagen fibers, resulting in good fibers. And whereas a 10 results from non-functioning of plasma fibronectin. So these are the various types of Ehlers-Danlos syndrome. Now going on into clinical features. So clinical features, basically there will be defective collagen, right? So here that suppleness will be more. So there will be hyperelasticity of the skin. Normal, you see, as you can see in the picture. So you can even pick up the skin from the underlying subcutaneous tissue because of the hyperelasticity. So as collagen is defective, any injury, there will be unusual healing response. So the healing response will be, it resembles like crumpled cigarette paper appearance, that is called as papyraceous scarring. As you can see in the second picture in the knee, you can see that unusual healing response, which is called as papyraceous scarring. Okay, sometimes there can be hypermobility of the joints because of the collagen defect. As you can see in the third picture, there is hypermobility, hyperextensibility of the joints will be there. Okay, so in some individuals, this skin extensibility and joint extensibility is so much pronounced, the patient will has become known as circus rubber man. Okay, rubber man appearance. So what will be the oral manifestations in Ehlers-Danlos syndrome? So here the mucosa will be normal only, but it will be excessively fragile and it will bruise very easily. And even gingiva also, it will appear fragile and it will easily bleed upon toothbrushing and all. And sometimes it can result in gingival hyperplasia, and fibrous nodules also can appear in gingiva. And as hypermobility is there in other joints, even hypermobility can be seen in TMJ, resulting in dislocation of the jaws. So this is about Ehlers-Danlos syndrome and its clinical features and oral manifestations. Now let's see about another disease, that is psoriasis. Here it is also one of the skin disorder wherein the tissue, that is the skin, will appear inflamed and edematous. But this inflamed and edematous area will be covered by silvery white scales. So this silvery white scale appearance is very characteristic of psoriasis. Why it occurs? Because of the underlying thing, that is increased activity of T cells in the underlying skin, because of the increased activity of the T lymphocytes. Why there is increased activity of this T cells in psoriasis? So what is the pathogenesis behind it? So there are some environmental agents, and sometimes even psoriasis is said to have genetic susceptibility also, that is environmental agents or genetic susceptibility by HLA, CW6 and B57. These are various genes that might result in epithelial injury or keratinocyte injury. Whenever there is an injury, there will be antigen presentation by antigen presenting cells, that is Langerhans cells to T cells which are present in the lymph node. So now the T cells will be activated against the antigen that has caused the keratinocyte injury. So T cell activation has occurred. So now this T cell which is activated, it will produce some cytokines, which abnormal production of cytokines as well as growth factors will be seen by T cells. Now that these abnormally produced cytokines as well as growth factors, they will move towards the keratinocytes and they help in increased proliferation of keratinocytes. Abnormally keratinocyte proliferation will be increased. that is the main reason, that is keratinocyte proliferation is the main reason behind this silvery white scale appearance in psoriasis. So this is about the pathogenesis of psoriasis. Now what will be the clinical features? So here the clinical features will be like mainly as you can see in the picture, inflamed edematous area which is covered by silvery white scales. That white appearance is there. Yeah, so there will be dry papules with silvery scales. But whenever if you start to remove these deep scales, so if these deep scales are removed, we start to observe some tiny bleeding points will be seen. This kind of sign, when scales are removed and tiny bleeding points are seen, this kind of sign is called as Auspitz sign, which is characteristic of psoriasis. Auspitz sign. And what will be the oral manifestations here? Usually oral manifestations are very rare, but if it occurs, they will range from white plaques to red plaques, and sometimes they might result in ulcerations also. As you can see here, palate is involved. There are some white plaques as well as ulcerations here. So these are called as psoriasiform lesions, which are even seen in Reiter's syndrome as well as benign migratory glossitis. So these lesions are called as psoriasiform lesions. So this is about clinical features of psoriasis as well as pathogenesis. Now let's see histological features. As there is abnormal keratinocyte proliferation, histologically what do we see? There will be parakeratosis, definitely. Parakeratin production, increased parakeratin production will be there. And as there is increased epithelial proliferation, there will be elongated reti ridges will be seen, as you can see in the picture. And the connective tissue papillae also, they start to show these dilated capillaries. So because of this dilated capillaries only, whenever we remove that deep scales on the top, the tiny bleeding points which you observe, it is because of the connective tissue papillae with dilated papillaries only. And sometimes within the epithelium, that is within the parakeratin layer, we tend to see these inflammatory cell infiltrate in the form of neutrophils. This type of small abscesses are within the epithelium are called as Monro's abscesses that are seen in parakeratin layer. It is a characteristic feature of psoriasis. So this is in detail about psoriasis and various other lesions. So what all we have discussed in the second part of skin diseases, we have discussed about systemic lupus erythematosus, systemic sclerosis, erythema multiforme, Ehlers-Danlos syndrome, as well as psoriasis in detail, where either clinical features or some of the signs or histopathological features or entire disease itself can come as the short notes or very short notes. So kindly concentrate and try to learn the pathogenesis first, so that you will understand the clinical features and the histological features properly.